Welcome to a new episode of our weekly web series COVID-19 Science and Context. I'm Sabine and joining me today is Dr Anne Cori. Anne, the past few weeks have revolved around better understanding the Omicron variant. How do we detect a new variant of concern?
Surveillance of SARS-CoV-2 cases globally includes regular sequencing of the virus to track viral evolution. This allows detecting variants as Omicron which have accumulated many mutations. For Omicron, there's also a simpler way of distinguishing it from the Delta variant because it has an S gene deletion which you can see from PCR test results. So you have a good indication of whether a case is Omicron or Delta without sequencing their virus. You can then look at the rate of growth of Omicron cases and compare it to Delta. And the signal has been very clear that Omicron cases grow much faster than Delta.
So why is this particular variant spreading more?
There are two main reasons why variants can spread faster, because they're intrinsically more transmissible and/or because they escape the protection from vaccines and previous infection. And Omicron has both of those. So our analysis suggests vaccines are less protective against Omicron infection than Delta infection. And this reduction is large after 2 vaccine doses, but fortunately much smaller after boosters. Similar analysis on hospitalized cases could detect changes in vaccine effectiveness against severe disease, but at the moment in the UK, there are still too few hospitalized Omicron cases to conclude on this.
So what does this mean for the future?
We expect Omicron to rapidly replace Delta globally. Cases are going to continue increasing. Limiting at-risk contacts between people, for example, by working from home and wearing masks, and continuing to deliver boosters will help slow the epidemic. If protection against severe disease is not sufficient, then more restrictions on contacts may be needed to avoid overwhelming hospitals. Omicron should serve as a reminder that countries need to organize to have a global and more coordinated approach to vaccine delivery, which will minimize the risk of emergence of future variants.
Thank you for your time.
Thank you.